Hi everybody, my name is Jamie Van Allen, and today we're going to go over one of the most important organs in your body, the heart, and how you as a nurse will be able to understand the circulation and in return be able to read EKG strips. The objectives that we're going to cover are the anatomy of the heart, the flow of blood through the heart, the steps in the cardiac cycle, and in the end, how to read the EKG strip. Your heart is a muscular organ. It's about the size of your fist, and it's comprised of a sac known as the pericardium, vessels, arteries, chambers, and valves. So your heart is actually divided into a right and left side, which protects the oxygen-rich blood from mixing with the oxygen-poor blood. The oxygen-poor blood returns to the right side of the heart with both the atrium and the ventricle after circulating through your body and pumps blood into the lungs through the pulmonary arteries. The lungs then refresh the blood with a new supply of oxygen, and that oxygen-rich blood returns to the left side. There are 4 valves in your heart, and they actually keep the blood flowing appropriate ways. You have the tricuspid and mitral valves, which are known as the atrioventricular valves. They comprise the first part of the sound of your heart, which is the lub. And then the second part of your heart, which is the dub, is comprised of the semilunar valves, which are the pulmonary and aortic valves. So as you can tell, everything kind of works in synchrony, and it's a pretty delicate system. So your average heart beats about 100,000 times in a day, or about 35 times in a year. For your cardiac cycle, your heart has electrical wiring which keeps it beating. It's these electrical impulses actually that begin high in the right atrium in the sinoatrial or SA node. And they travel through a special pathway to the ventricles, and that delivers the signal to pump. It's this conduction system that keeps your heart beating in a coordinated and normal rhythm, which in turn keeps the blood flowing adequately. The beating heart contracts and relaxes. The contraction is called systole, and the relaxation is actually called diastole. It's during your systole period that your ventricles contract and force blood into the vessels which go into the lungs and through the body. The ventricles then relax during diastole and are filled with blood coming from the upper chambers on the left and right side of the atria into the ventricles. After that's complete, the whole cycle then starts over again. All right, so now that we've taken a look at the way your heart functions from the inside, we can take an outside look from your heart through electrocardiography. This is the method of recording the heart's electrical activity. You do it by hooking up a number of different electrodes. You can have a 3-lead electrode, a 5-lead electrode reading, or you can have what's called a 12-lead EKG, but really there's only 10 electrodes there. Okay, so there's different parts of the EKG reading, and they actually indicate the electrical events during one heartbeat. The ones that we're going to focus on include the P, the QRS, and then the T, and then there's also some intervals in there. So the P wave right here is actually the first short upward movement of the EKG, and that indicates that the atria are contracting and pumping blood into the ventricles. The next one right here is your QRS complex that's made up of 3 waves, and it begins with the initial downward spike of the Q wave and then comes back to an upward spike of the R and back down to the S. This QRS complex actually represents ventricular depolarization and contraction. So then here you have what's known as the PR interval, and that actually is the transit time for the signal from the heart to travel from the sinus node into the ventricles. And then last we have this right here, which is the T wave. It's a fairly moderate upward wave, and it actually represents ventricular repolarization and the QT interval. So what I want to actually look at right now on the EKG is you have to learn how to read it. So you have measurements that are kind of standard that we like to see. You have some small boxes, and then those small boxes actually comprise large boxes. So I have actually made a small replica of what a EKG tracing is gonna, or sorry, what the EKG strip looks like, and we'll draw the EKG reading. So here you'll see the very small little boxes, and that measurement is 0.04. The big measurements are 5 of those little boxes, so they actually equal 0.20. For a good PR interval, you actually want to see it one of these boxes or maybe a tad bit smaller. You don't want to see it any larger than that, or else you're going to start maybe seeing some arrhythmias. Then you have the PR interval. Oh, sorry, that's actually what we just covered. The QRS complex, which can be anywhere from, we like it to be 2 of these boxes or maybe 2.5 of the boxes. And then the QT interval, which is from here the whole way to here, and we like to see that at 0.40. So what you're going to see for a reading is you would see the P wave that possibly comes like this and back down to the Q, and then comes back up to an R, and then down to an S, and then over, and then finally the T. So as you can see, a rough look at this, I'm not the best drawer, is that you have a PR interval that is 0.20 exactly. You have your QRS, which is 0.08, and then you have your QT, which estimated looks like it's about 0.32. So for the rhythms, we're going to start with your good rhythm that you want to see, which is called a sinus rhythm. So the sinus rhythm is any cardiac rhythm where the cardiac muscles begin at the SA node, which again is the atrial sinus node. It's characterized by the presence of correctly oriented P waves, which is the 0.20 or maybe a little bit less, and a heart rate ranging from 60 to 100. The way that you would count the heart rate is this right here is a 6-second strip. So you're going to count your QRS complexes. So for sinus rhythm here, you see 1, 2, 3, 4, 5, 6, 7. So this heart rate is 70 beats per minute. Then you have sinus bradycardia, and this is where the SA node still fires correctly, but it's slower than your sinus rhythm. So it's anything less than 60. Again, you have 1, 2, 3, 4. So this person here has a heartbeat of 40 beats per minute. And then you have sinus tachycardia, where the SA node, very similar to sinus rhythm and sinus brady, fires correctly. However, it's just at a faster pace. So anything over 100 is going to be sinus tachycardia. So for the first set of arrhythmias, we're going to talk about atrial dysrhythmias and ventricular dysrhythmias. So for atrial, you have A flutter and A fib. These are arrhythmias that actually originate in the atria. So they have atrial contraction, and your P wave is missing at this point. So you have AFib, and it's caused by a rapid, uncoordinated twitching of the myocardium of the atria. So basically what you're seeing here is sometimes it can be flat right there, or you're going to see just some nice, small, subtle waves. And then with the A flutter, it's kind of the same situation. However, it's regular, where you have your QRS to QRS, or your R to R interval, and they are the same distance apart, where in A fib, they're not the same distance apart. Another determining factor for A flutter is the distinct sawtooth mark, where it's a little bit more jagged. Back to the atrial dysrhythmias, you're going to have some symptoms or maybe not some symptoms, and they include a racing heart or palpitations, shortness of breath, and some dizziness. For medications you would use to control, you could use electrical shock or cardioversion, or you could do procedures that destroy the abnormal tissue to the heart, and hopefully in return it'll restore normal function. For ventricular dysrhythmias, you have premature ventricular contraction, also known as PVCs. You have ventricular tachycardia, and then ventricular fibrillation. So these are dysrhythmias that are beginning in the ventricles. PVCs are actually pretty common and usually fairly benign. It's an event where the heartbeat is initiated in the Purkinje fibers in the ventricles rather than in the atrium at the SA node. So basically the ventricles are contracting before they've adequately filled up with the blood supply. So a single PVC, probably not a big deal for us. Anything more than 4 to 5 PVCs, you may start to see some symptoms, and that includes dyspnea, shortness of breath, dizziness, and also palpitations. Kind of similar to the atrial dysrhythmias, we might treat them with medications. It could be an electrolyte imbalance here, so we're going to replace electrolytes if we need to, possible ablation, or just lifestyle changes, better eating, more exercise. For ventricular tachycardia, also known as VTAC, it's a regular fast heartbeat that arises from improper electrical activity into the ventricles in the heart. So a few seconds, again, probably not a huge deal, probably not very symptomatic, but anything longer than that, you're going to have a patient that's lightheaded, they have palpitations, some chest discomfort, and that dysrhythmia then can lead into ventricular fibrillation, which is a lethal arrhythmia, and it's actually one that we're going to start cardiac defibrillation. The patient's going to go into arrest, and we're going to start CPR. So now that we kind of have a general idea of everything, let's take a look at a case study. We have our friend here. He's a 53-year-old male. He presents to the emergency department with palpitations, shortness of breath, and chest discomfort. So that alone tells us, hey, we might have some kind of arrhythmia here, but whether it's an atrial dysrhythmia or a ventricular dysrhythmia, we're not sure. So we're going to need to run an EKG. And we do that, and then this is the EKG strip that we have. So looking at this, what do we have? We have regular R to R intervals with the QRS complexes, and we have what we kind of already know as the sawtooth. So we have a student here with us today by the name of Sade. So Sade, what arrhythmia was that?
Eighth letter?
That's correct. So for that, what we're going to do is we're going to go ahead and probably treat them with the medications, or if we needed to, we would then cardiovert them if the medications don't work. If you want to keep practicing the EKG strips, we have a helpful website here. It's actually very interactive. There are going to be a number of other EKG strips here. However, if you want to go at your own pace and kind of self-teach yourself, you're more than welcome to. If you get it wrong, or even if you get it correct, it'll show you the reasoning as to why it's one arrhythmia or not. So I hope you've enjoyed our lesson, and I wish you the best of luck in your cardiac endeavors and being able to read EKGs.